Yeah, so I'm Sonal Tambe, co-founder and CEO of Nimble Heart, and Dr. Pramod Deshmukh and I founded Nimble Heart to take preventive cardiac monitoring to next level. So traditionally, exercise ECG was used only for secondary prevention on cardiac rehabilitation patients, and now we have made it so that people can use it. I mean, it can be used to administer exercise ECG out of clinical settings as well to a wider population who is at risk, including primary preventive care patients who are at cardiac risk. And we are also covering at this time first responders, and we plan to cover the athletes who are at risk due to cardiovascular events, and eventually more population. So just like we want to make exercise ECG monitoring like your dental x-rays that you have regularly every year or twice a year to make sure you get proactive treatment and surgery so that overall healthcare costs can be reduced in this country. So so first of all, it's not a continuous type monitor like I mentioned, dental x-ray. It is like a preventive care checkup. Of course, rehab patients have it for 36 sessions during 3 months, but our model is like first responders, for example, right? So they get this exercise ECG test. We are not replacing the hospital's diagnostic 12-lead test, which is done just before their surgery to find where the problem is. But our test is something where our electrodes and our device is designed such that it can detect early if there are any arrhythmias or ST segment changes when the patient is exercising, where the heart is under stress. So because of that, they can be referred. So that's how when, like, for example, a female cop was feeling funny and a smartwatch didn't tell her what was happening. That's our customer's customer, by the way. And then they did our monitoring exercise ECG test, and that report showed arrhythmias. That report was taken to the hospital to do more diagnostics and schedule the treatment for her. So we basically catch the attention of the diagnostic or the treatment cardiology staff early, because the hospitals won't have time to do all this preventive care, right? So the wellness companies, preventive care companies, they can take that responsibility so that with our technology, we can offer this kind of proactive care and monitoring to a larger population of people. And as American Heart Association says, right, 157, and I saw that number elsewhere, 157 million workforce people, right? And they're what they call, I read that number yesterday, cardiovascular health index, that is so low. And most of our population is working age population, which is like close to their 60s. And they have all these, like, even, for example, a hypertension patient, they are also at risk. And this is another, sorry, I'm not going over time, right? I have a lot to talk. Okay, so this is one of my favorite success stories, and because this was on our own team member, and our own team member, a quality assurance person, he was like wearing one, like I have one right now on me. He was wearing one, and we were monitoring him, and I was looking at the data on our portal, and I saw the anomalies. And he was hypertension person, and typical, male in 51-year-old. His dad had surgery, and we saw those arrhythmias happening bigeminies and trigeminies while he was just walking around. So we took his report from Nimble Heart portal, and he took it to his Stanford physician. Then they did his stress echo and all that, and he was diagnosed with mitral valve regurgitation. So he did a proactive planned surgery. He did not have a heart attack. He's literally shopped around the cardiologist, and he's picked the cardiologist he said, I have done lots of such surgeries. And he's back to work now. And I mean, it feels so good, because it saves everyone the trauma of having a heart attack. And so that's our vision for future.
Thank you so much.